Okay. I think a well-structured, adequately resourced and importantly properly staffed health system is indisputably a central function of any government for the main services they provide to the community. And the nursing profession is obviously central to the health system. But from what I've been reading, it's not easy being a nurse in Queensland at the moment, with significant staff shortages that are projected to get much worse in the short term, and some significant pay inequities, especially for nurses working in the aged care sector, and now also a lot of uncertainty surrounding the pay and conditions that will apply to your profession going forward, given the unresolved enterprise bargaining agreement, and also, particularly alarmingly, escalating rates of violence and accident and injury befalling nurses on the job. I think it's small wonder that the profession is struggling to recruit and retain adequate numbers of appropriately skilled and qualified nurses. So for those nurses who do remain in the health system and keep providing these essential services to the community, thank you. I think the Greens and the Queensland Greens in particular find that we are in significant agreement with the recommendations and the requests of the nursing profession as expressed through your union. We think there does need to be greater recruitment of nurses. There do need to be more nurses moving into the public health system. There are a lot of qualified nurses graduating but not being recruited, and that needs to be turned around. We do need greater incentives and support for nurses to be working in regional and rural areas where the need is so great. There is a need for greater money to be spent on training and professional development, not only to ensure an appropriate skill mix amongst the workforce, but also to ensure that the workforce remains engaged and feels like there's some progress to be made. In that regard, I think having a pay structure that rewards the accumulation of experience is also important for keeping people engaged and giving them some sense that there is career progress to be had within the system. And I think most of these things are uncontroversial. I think they're non-partisan. I think probably anybody would agree with the statements that I just made. But I think the problems that we run into is having an overstretched health budget and how do we pay for all of those things. And I think that's kind of where the Greens make a bit of a unique contribution in our focus on primary and preventive healthcare and trying to put more attention on keeping people well and keeping them outside the hospital system. In Queensland, as in Australia, and in fact as in most advanced Western liberal democracies, health spending's on an unsustainable trajectory. Year by year it increases as a proportion of gross product, and I think you don't need a Green with our emphasis on sustainability and long-term perspectives to tell you that that's unsustainable. It has to reach a point where that can't keep continuing. In Queensland, the increase in health expenditure has been particularly dramatic, and it's more than doubled since 2005. Over 70% of what we spend on health in Queensland goes on the hospital system, and less than 5% is spent on prevention. Yet we know that over 30%, while I'm rattling off numbers, of what it turns up in our hospital system is from preventable causes. And so just a couple of weeks ago, the Queensland Greens launched some proposals to try to bring more of a focus onto primary and preventive healthcare and keeping people outside the hospital system. And the importance of that, I think, for the nursing profession is not only the role that you can play in primary and preventative healthcare, but also if we can shift some of that burden outside our hospital system and keep the hospital system more focused on acute, unpreventable medical needs, which is its proper focus, then that means in the longer term, more public resources available to attend to precisely the things that you're asking for, to ensure that your salary increments do at least keep pace with inflation. There is more money for professional training and development, and there is more money to hire and recruit more nurses. So A couple of weeks ago, we launched a proposal for a Queensland Health Promotion Foundation, which is based on the highly successful Victorian equivalent, which would give us an independent statutory authority to start harvesting some of that low-hanging fruit of prevention. We also suggested another $25 million go into community-based mental health services, particularly in the highly successful Housing and Support Program, which was independently reviewed in 2010 and was shown not only to improve outcomes and quality of life for people suffering mental illness, but to lead to significant savings in the health system because it keeps people out of hospital. Was that the end? Or was
That's
that
the end,
seconds?
Adam.
And just imagine I said all sorts of wonderful extra things.
Cut. Thank you.